Perform hand hygiene, gather equipment, and don gloves. Maintain no-touch aseptic technique for equipment in contact with IV solution to prevent risk of infection. Prepare heparinized bag using 1,000 ml of 0.45% normal saline. Insert 0.5 ml of 1,000 units per ml heparin to make a final concentration of 0.5 units per ml. This is the standard continuous infusion concentration unless otherwise ordered. Prepare the standard concentration tubing. Attach prepared IV bag to standard concentration tubing and prime using a 10 ml syringe. Fill set with solution, removing all visible air. Attach standard concentration set to IV line port of VAMP Junior set. Check all VAMP Junior connections are tight when removing out of the package. Keep standard concentration line open to allow for fluid movement during transducer setup. Open reservoir plunger to approximately 1/2 ml, facilitating the flow of priming solution. Open the two shutoff valves, which would mean parallel to the tubing, and hold sampling site above the reservoir at a 45-degree angle. This allows any air in the line to rise and be easily removed during priming. Prime the transducer set. While the stopcock is turned off to the line and is open to the transducer head port, depress syringe plunger and provide flow by pulling the yellow snap tab of the pressure transducer while slowly delivering the priming solution. Remove all air from the system during priming. Once the transducer head is primed, close the stopcock and change the initial white open cap to the alternate white closed cap provided in the package. The initial white cap has an open end to help with priming. Replacing it when the alternate closed white cap provides a closed system and decreases the risk of an infection. While maintaining the line at a 45-degree angle, close the plunger, removing all air from the system. Ensure the vamp junior and IV line is filled with fluid, paying close attention to the sample ports as air can often get caught here and will need to be flicked out. Any air in the pressure system can lead to an air emboli. Additionally, air can compromise the dynamic response of the system and interferes with accurate blood pressure measurement. Load the syringe and primed administration set into the syringe pump. It is important to add a single, open, no-valve extension set to the UAC, which provides a way to clamp the arterial line in case of an emergency. Clamp the extension set attached to the UAC. Attach the vamp junior set up to the end of the extension set of the UAC. Orders for infusion rate will be provided but should not exceed 2 mL per hour to minimize fluid intake and not less than 0.5 mL per hour to ensure line patency. An arterial line should always have a continuous infusion running through it. Never infuse a medication through a UAC unless ordered. Only the 0.45% normal saline with 0.5 units per ml of heparin should be infused continuously unless ordered. Secure the vamp junior with tape on a folded diaper cloth and place at heart level. Connect blood pressure cable to monitor and to disposable transducer. Once an infant is connected to arterial pressure monitoring, the monitor is calibrated immediately. Position the transducer head horizontally so that the stopcock port is at heart level. Clamp the arterial line closest to the patient by either clamping the extension set or by turning the valves on the vamp junior off, turning the valve perpendicular to the line. It is important to ensure the line is off to the patient to prevent accidental hemorrhage. Turn the stopcock off to the patient's side. Scrub the port before opening the dead end cap with an alcohol swab. Open the transducer head to air by removing or loosening the white cap dead end from stopcock port. Check to ensure that there is no backflow of blood. In the event a line is not clamped off to the patient, blood will back up quickly. Depress the key labeled 0 on the blood pressure module until a tone is emitted, and you see a 0 on the monitor screen. The 0 and calibration process is complete when the monitor states that the line has been calibrated. Secure the dead end cap on the transducer head and open the stopcock to the patient. Unclamp the arterial line to the patient by either unclamping the extension set or by turning the valves on the VAMP Junior open, turning the valve parallel to the line. Verify adequate waveform. Document that calibration has been done. Observe the system hourly for blood clots, a dampened or flat waveform, and color perfusion to the limbs or abdomen. If any of these are observed, further assessment is required, and the physician NP should be notified immediately. Complete a focused assessment of peripheral circulation, color, femoral and pedal pulses, observation for any bruising or petechiae, and temperature of limb. If a peripheral arterial line is in place, monitor the radial pulse. Perform hand hygiene, gather equipment, and don gloves. It is important to have all equipment ready to go, including pre-drawn up heparinized flush solutions ready at the bedside on a clean linen to ensure a clean working space and preventing any blood spatter from dirtying the patient bed. If a blood gas is needed to be collected, ensure RT at bedside prior to starting procedure. Ideally, this is a two-person job. One person performs the blood sampling procedure. The second person is used to support the infant, observe the site while blood sampling is performed, and to place the collected blood into the appropriate vials. It is important to perform arterial blood draws efficiently to avoid stationary blood in the line, which may result in clot formation. Stationary blood should remain in the VAMP Junior for no longer than 3 minutes maximum. Silence ECG monitor alarms for a line with monitored blood pressure. Pause the infusion on the syringe pump. Close the distal valve by turning the handle perpendicular to the tubing. Smoothly and evenly pull up on the reservoir plunger to draw approximately 1 to 1.5 mils of clearing volume, assessing when pure blood is at the sampling site. Recommended pull rate is 1 mil every 10 to 15 seconds. It is important to avoid quick withdrawal of blood, as this may result in spasm of the artery. Close the proximal shutoff valve by turning the handle perpendicular to tubing to minimize contamination of the sample by infusion fluid. Swab proximal sample site with alcohol swab and allow to dry. Ensure plunger is depressed to the bottom of the sampling syringe. Insert syringe with blunt end cannula into proximal sampling site. Slowly draw blood sample as required. Recommended pull rate is 1 mil every 10 to 15 seconds. Draw ABG first, followed by any lab work. Remove syringe from the sampling site by pulling straight out. Hand to person assisting with blood collection to decant into appropriate specimen tubes. For blood gas samples, remove the blunt cannula, apply a stopper, and expel any air. Hand to RT to run ABG. Clear the infusion line immediately because stationary blood may result in clot formation. Open the proximal valve by turning handle parallel to the tubing. Return the clearing volume by slowly, smoothly, and evenly pushing down on the plunger of the VAMP Junior until it is fully closed. Recommended return rate is 1 mil every 10 to 15 seconds. Infusing too rapidly or using excessive volumes can cause arteriospasm and subsequent complications. Ensure the heparinized flush syringe is free of air. Swab distal access port with alcohol swab and allow to dry. Insert heparinized flush syringe with the blunt cannula into the distal access port. Slowly flush the line just until the blood is cleared from the line, approximately 0.5 to 1.5 mils. You may need to pulse the flush to create enough turbulence to actually clear the tubing and sample ports of blood. The VAMP Junior may need to be held down during this step so that the flush does not pool in the reservoir. Open the distal valve. Resume the infusion on the syringe pump. Check position of the valves and ensure connections are tight. No blood should back up into the line. Cleanse the proximal and distal sampling site with alcohol swab to remove any contaminants such as residual blood or fluid. Activate monitor alarms. Assess site and waveform. If site symptomatic or waveform dampens after blood draw, notify charge RN. Record blood withdrawal procedure.